Becky Moore is a clinical dental hygienist, educator, speaker, and author with over 30 years of experience in oral systemic care. She founded Restart Hygiene and wrote Beyond the Dental Chair, What Your Dental Hygienist Didn't Tell You About Your Mouth, a book focused on the critical link between oral health and overall wellness. After overcoming a career crossroads, Becky refocused on purpose-driven care and continued learning, which helped her thrive in the changing dental landscape. She holds certifications in oral systemic education and a BS in oral health promotion. With a passion for education, she empowers both patients and dental professionals through evidence-based prevention, patient education, and support for sustainable careers in dental hygiene. Hi, welcome to the Lifestyle Herbalist, the podcast where holistic wellness meets everyday living. I'm your host, Dabney Vaccaro. I'm a registered dental hygienist, a clinical herbalist, and a certified health coach.
And I'm your co-host, Sabrina Cooper, a registered dental hygienist with a bachelor's in oral health promotion, a certified culinary nutritionist and herbalist, and a mindfulness and mindful eating coach. Together, we explore the intersection of holistic health, herbal wisdom, and joyful living. From plant-powered remedies to kitchen medicine, mindful moments, and conversations that feed the soul, we're here to help you feel vibrant, grounded, and inspired in your daily life. So steep a cup of something soothing, settle in, and let's grow well together one episode at a time, bringing you a healthy dose of happiness.
Hey, we're so happy to have you here today, Becky. I first met Becky as a student with O'Hare University, and she graduated in 2019. It's been a little bit, but I remember you being really excited about hygiene, but wondering where your career was going to go. And I also remember you talking a lot about the oral systemic link then, but and in the beginning, I remember you being rather shy, maybe not talking immediately, with the group. But then as we had our time together, you seemed to gain more confidence and you seemed to gain more clarity in where you wanted to go. And it's been really exciting to see you blossom in your profession. And now you have a book, you are a speaker. And Becky, I'm just so proud of you as an OHU grad and somebody who helped you along your journey. We're just really proud of you. So welcome to the podcast today.
Thank you, Dabney. I appreciate you inviting me to come, and I'm excited to share a little bit of my knowledge and clinical skills with the audience.
So I'm
That's good.
curious, Becky, what made you get so excited about oral systemic link?
Well, I graduated in 1993 from a small community college in Jacksonville, North Carolina, and we didn't talk about this. This was not known. They didn't talk about. I just thought I was going to clean teeth and put sealants on and educate patients about how to brush their teeth. But when the oral systemic link information came out, for me, it was just a rejuvenation and a passion for my profession that was changing and evolving, and it was allowing me to help to be a part of the body more. So I just enjoy learning, and that was part of my journey was just cleaning teeth or just feeling like it was a job versus a passion in the career and changing lives.
Wow, that's really great. So what landed you into now you've written this book that you're now promoting? It's on Amazon, it's in major retail stores. So that's a big deal.
Well, thank you. That was it's a lifelong journey to be able to write the book. The book itself was a challenge. I never thought that I would be an author, but I just felt like that even clinical hygiene, and you guys know this, you don't have enough time to tell the patients all the things that they need to tell them about how to improve their oral health. And I mean, I'm thinking of things as the patient's walking out the door going, I can't tell them anymore because I'm just at them like a fire hose. So trying to wean that down and not give them too much information was something that I thought I just need to put it in a book. I need to put it somewhere where it can always be picked up and referred to, and it can help patients. And to me, when I wrote the book, it was more about helping everyday patients that maybe don't have dental insurance or not allowed to go to the dentist, or they don't maybe even understand about the oral systemic link, and becoming more holistic minded as I've gotten older and gotten in my career deeper, because we can use products and ingredients that don't don't cause as much change to the body if we just learn more, but they're not always easy and accessible to find.
Yeah. Well, I know Sabrina, she's a culinary expert and talks a lot about mindful eating and just learning
Hmm.
and practicing certain ways of living can make a huge difference in somebody's health. And we all know that, and we now that our body and our mouth, it's all connected. Um,
Yes.
There's a
yeah.
lot that we can tell from patients when we see them in practice. I know myself when I'm in practice, I can almost pinpoint those patients or clients who are, eating healthy and being more mindful about what they're putting in their body and doing with themselves, because you can see it in their mouth, with the less tartar, less calculus, less plaque buildup, bleeding,
Hmm.
inflammation, all those things, we'll talk about in a few minutes, but it's definitely evident that there is that connection and more people need to be aware. So,
Absolutely agree.
Yeah. So one of the things I know you wanted to really touch on today was just talking about myths. And, all three of us are here as dental hygienists, Sabrina, Becky, and myself, who are currently working with the public. And, you know, people have these belief systems and they believe certain things that they've heard through the generations. But one of them is that baby teeth don't matter and they're going to fall out anyway. Why did you want to touch on this one?
Well, because I was guilty of it. I have children and I gave them candy and sweets that were acidic as battery acid, but all this did not come in my mind. I didn't understand all that at the time. So I just want to promote health early as we can with our children because if we don't take care of the baby teeth, the adult teeth don't have a guide to help them in. We also know about airway now. I didn't understand about the airway. If we don't have proper teeth in proper places, the airway is going to be smaller, and just the way that they grow is really important. So teeth do matter. They have many functions, and just the ones that I just talked about are enough to just be aware of that.
Yeah, what long-term problems do you typically encounter and that you can actually, as an adult, that you can trace back to a childhood for oral health?
For me, I look at airway a lot these days. I've delved into
Hmm.
that. It's part of the science. And if patients don't take care of their teeth and don't have proper health, and they lose teeth or they have teeth that don't function correctly, they're not going to be able to breathe properly, which is going to affect all aspects of their health. So to me, that to me supersedes the oral bacteria if it's in a bad enough condition. I'll say it that way
Hmm.
because we have to have air. We have to be able to breathe air properly and get our body's nutrients from the oxygen that we breathe, and we need to filter it with our nose, not our mouth.
Yeah. Well, and oftentimes, at least in my practice, I've heard doctors and even hygienists say, "Oh, you've got a small little cavity. We'll just get you back in here and take care of that." And I know that
Right.
I have said those things too, to
Hmm.
try and take the fear, I guess, out of, what the little child is going to have to go through. But as I reflected on that, we should be sounding the alarm bells like, oh my goodness, you have a cavity. Let's trace that and figure out where did that come from? And what can we do in the future so that we don't ever have this again? Because we know as clinicians, right? They have the first little filling. Then 10 or 15 years later, there might be a gap there. They might get reoccurrent decay around it. Then they get a
Hmm.
bigger filling. Then they get a bigger filling. Then they get a crown. Then the tooth
Hmm.
dies, and perhaps they had a root canal or even tooth loss. So this little tiny cavity that we could have avoided, eventually it might end up in tooth loss as the decades roll on.
Absolutely. I agree with that too. And the first thing that I think about, since I've learned more about the airway, I go back to that. But if we're having habitual cavities, it may not be just about what sugar we're eating. It could be acid from our stomach eroding the enamel or demineralizing. We're not putting the proper minerals back into our teeth. There's other options besides fluoride to do that nowadays, we know with nanohydroxyapatite. But yes, you're right. The snowball effect of one tiny cavity is huge and it's preventable. That's the main thing. It's preventable, but we don't always get that information to understand how cavity forms. So I think that's a really important point.
Hmm. Great. Yeah. Well, and you're talking about acid. I had a patient just yesterday who had severe acid wear on her teeth. And we talked about it 6 months earlier and was trying to help her understand like what was happening in her mouth. She finally went to her doctor and then she got an endoscopy to find out what was going on in her esophagus. And they said that for sure she's having some acid reflux going on. They could see signs in her esophagus and they put her on a PPI. Um,
Hmm.
so I then told her about the problems with being on those long term. And, it would be really best to try to get to the root of the problem. And if I suggested that maybe she try a elimination diet to see if there's something that she's consuming, because obviously, you know, these PPIs can help for a little while, but long term, it's just not a great idea. It has problems with bone density and stomach
Hmm.
issues. And she says, well, osteopenia runs in my family, osteoporosis, like that's a problem. Like I got to get to the root of it. So I think she was encouraged to try and find that root cause. But she says, funny enough, the doctors never said anything to me about my diet. I was like, yeah, I'm
Hmm.
not surprised. They're not equipped to do that. Typically, it's a referral to a specialist about nutrition.
That breaks my heart to hear because I've had the same conversations with my patients who don't understand the repercussions of the medication that they're going to take, or or what's your family history related to this? And then it starts opening up signs for them to see and making them part of the conversation too, asking questions. I learned about that more in O'Hare was whenever we learned to motivational interview our patients, ask them questions. Sometimes they look at me like, "Are you going to quit asking me questions?" But it's to gain that information about how I can serve them and their needs better and where they're at with their health and where they're at with their knowledge of their health conditions. So I
Yeah,
think that's important.
so agree. So the next myth is cavities are genetic and there's nothing you can do about it.
Oh, this is a good one. So cavities are not genetic. Maybe your teeth not having as much enamel on them, stuff like that can be inherited or the way your body makes. But a lot of times we inherit not just genes from our families, but we also inherit the way that we live, we eat, we function. And so that's the biggest thing, in my opinion. What I've seen through the years is not genetic. You didn't get cavities because your mom had them. You get cavities because you eat like your mom ate. So
That is so true.
that's a general rule, and drink too.
Hmm. Yeah, I agree. There is a whole lot of habits that are inherited, not so much the genetic microbiome and that sort of thing. Although microbiome does have an effect, but if you're feeding that bacteria, that's the problem.
True that.
Yeah.
I agree.
Yeah. And so if it doesn't hurt, it must not be a problem,
I love this
right?
one too. Yes, patients will say, I'm not going to fix it until it hurts me. Well, when it hurts you, it could have broken to a point where we can't fix the tooth. The decay could get much farther inside the tooth, and then you've got a bigger issue. So, pain, we can't rely on pain. Usually, when my back hurts, means I've done something way past the point of where it needed to be done. If I had a remembered what I was supposed to be doing, I wouldn't have done anything to hurt myself, and then I wouldn't have that inflammatory response or the disease that gets to start. And it's funny too because not just for teeth, but for gums. I often have conversations with patients about, and I ask this question in the beginning: Have you ever had any gingivitis or any periodontal issues? No, no, never had any of that. So when I'm going through with their cleaning, I do like to educate them as we're going through so they're not surprised at the end. And if I see bleeding, and most of the time I do see a little bleeding, I'll ask them if I can get them here and show them. So they're having bleeding of their gums, but they were not aware of it. So obviously, when bleeding gums bleed, it's a fever. It's a body trying to say, or like a fever, it's trying to alert you that something's wrong. But we don't know that unless we clean there or somebody shows us. So you can't depend on pain to give you a measure of how healthy or not healthy you are with your teeth or your gums, which is really important.
I think too on that topic with it, if it doesn't hurt, it isn't a problem. when you find something that might be small enough, or it hasn't been bothering them, or maybe it has a little bit. It's sometimes, in my case that I've experienced, is financial. Sometimes they
Mhm.
don't want to deal with the financial of fixing the issue or dealing with it. They're just afraid to say something because they know what it's going to do to them financially. And then you just have to reassure them that if they fix it when it's smaller and come in more frequently and come into the dentist more frequently, because a lot of times they're the ones that like go months without coming to the dentist,
Mhm.
that it will be less a burden on them, right? And that in long term, because like you said, it begins to snowball and then it could lead to health things and it could lead to so much more than just that one little fix.
True that. Absolutely true.
Yeah.
Well, and I know with looking at radiographs, sometimes we find infections at the end of roots with taking certain types of x-rays, and people don't have
Mhm.
pain, but yet they have an infection in their mouth. And people don't often think about like how close our teeth are to our brain. Do you really want that infection like circulating in your bloodstream and being so close to your brain? I mean, there are incidents where people actually have fatalities due to abscesses and infected teeth. So
Mhm.
not to be scary, but it is not necessarily painful at first, but it's something that we find typically on x-rays. And sometimes I find that people have large cavities, and especially older folks, like I think the nerve of the teeth kind of narrow and they don't often feel the things going on in their mouth. And sometimes I've been surprised that people don't have pain when I see such a large area of decay that was found on the radiograph.
Yes, and it's a good point too to let patients that are a little bit older, and understand that your nerve gets smaller as you get older. So the bacteria has to eat farther into the tooth and do more damage before you're likely going to feel it. So again, that's not a good measure. You can't depend on how something painful or not painful. It depends on the disease process there. Good
Yeah.
point. Very good point.
What are some signs that people should watch for before pain ever appears? I just want to pause to say thank you so much for joining me on the Lifestyle Herbalist. And I wanted to take a moment to share a brand I personally use and truly believe in, and that's Defender Shield. In a modern lifestyle, we're surrounded by phones, laptops, and Wi-Fi all day long. And as an herbalist and dental professional, I care about reducing everyday stressors on the body, not just what I'm eating, but what I'm exposed to as well. Defender Shield creates lab-tested EMF blocking cases, laptop pads, and accessories designed to help lower our daily exposure while we use our devices. If you've been looking for a simple, practical way to support your overall wellness environment, I highly recommend starting there. You can use the link in the show notes and receive 10% off your first order with Defender Shield. Now let's get back to the show.
I tell patients if they see staining on their teeth, that something's changing colors if you notice that. What else? Um, occasional pain here and there, it comes and goes.
Mm-hmm.
The cold sensitivity, not as much as the hot. The warm, hot, I'd be more concerned about hot things. Biting pressures are another one. But that could be so many different avenues. You gotta get to a dentist and have an evaluation done, x-rays done. What else, ladies? Y'all know too.
Food trapping. A lot of times I find people who start to have food trapping in areas that they never had before, like just checking
Mm-hmm.
in there. Sometimes you'll go and you'll look back and there was an observer. Our office has all the observes in one area. So you can go back and look and just make sure how long have we been observing it? Like, should we take a new x-ray? That kind of thing. And
Mm-hmm.
9 out of 10 times there's always something starting there, or like something that needs a little relook. So that's one for me, inflammation.
Yes. Well, and
Yeah.
two, patients being aware, like you said, if you trap food, that's an area that's likely to grow a cavity or something's going to change there. So that's a good point to bring up. If you're packing food, then be really careful. Those are usually the areas that are most suspicious, I'll say.
Right. And we all know because we were trained that disease typically starts in between the teeth, whether that's a
Hmm.
cavity, whether that's periodontal disease. It starts in between the teeth. People will brush, but oftentimes don't clean in between their teeth. And so if they don't clean in between the teeth, they won't really know that their gums are inflamed because they're not messing with them. And, sometimes when gums start to bleed, people tend to think, oh, I brushed too hard, I flossed too hard, I better just let that heal, and I'll just leave that alone. And that is not what you need to do. You need to go after it even more.
And as they
Exactly.
start, they don't sometimes hurt because they're in between the teeth, kind of hidden and covered, or, so it's more the ones that if they're on the occlusal, you're going to feel because you're chewing, you've got that like sugars, that thing getting into those little spaces, right? But in between, sometimes they can go unnoticed for a little while. So,
Mhm.
um, yeah.
Yeah,
True
good
that.
point.
True that. Whenever I was doing some research for the Beyond the Dental Chair book, I saw learned, and I was kind of surprised at this number about, and I call it the 60-40 rule. About 60% of your tooth, 60% of your tooth can be cleaned with your toothbrush. The other 40%, close to around 40%, cannot be. So often I'll ask patients, so you're brushing good, you're doing the 60%, but how about the other 40%? And they usually look at me like, huh. And I'm thinking, I know that's a big number, right? So if we
It's a
understand
good one.
60-40, it can help patients understand the importance of flossing. And then if they say, well, I'm not going to floss, well, let's figure out a way to help you to get those bugs from between the teeth.
Hmm. Yeah, there's a lot of great modalities these days. It's not just string floss. And, we've learned before that, string floss really isn't that effective. There's much more effective ways to clean in between the teeth. Yeah,
Absolutely. I'm thankful for that.
yes, same. Another myth, bleeding gums are normal. We touched on that just a moment ago, and just brush harder, right?
Well, let's go back to the 60-40 rule. We kind of
Right?
got ahead of ourselves there, didn't we? But yes, patients don't understand because a lot of times they don't see the bleeding. And so that's why if they'll allow me to with the mirror in hand when they're laying there actively getting their teeth cleaned, I love them to see the bleeding because oftentimes I'm asking them during the cleaning, is this uncomfortable? Is that hurting? No. Or I feel a little bit. And then I show them a great amount of, I mean, a decent amount of bleeding and they're like, oh my gosh. And so seeing this bleeding, to me, I tell patients, you can tell me that I should drive 55 miles per hour, but if you don't tell me why or show me, I'm not going to do it. So the same thing is applied to floss. And if I want you to floss, I have to show you. And most patients are open to that and they really appreciate being able to see that because most of them will say, I've never seen that much bleeding before, or my gums have never bled before. And I actually wrote this in the book about you just didn't see it. Maybe they just didn't take time to show you. And for years, I didn't either because I didn't understand how important it was for patients to understand the inflammation. So I think that's a good point.
Hmm. Yeah, so bad teeth just run in my family.
Well, again, again, the way we learn to live and eat, run in the family too. So we tend to, what is it? They say environment or genetic, which is stronger. It just depends on the situation. But when it comes to our teeth, I think our environment and our choices usually have the greater effect.
Becky,
Good
what
point.
would you say what's one family-wide change that could make the biggest difference?
Um, well, one thing that we know now that we didn't always know is after you brush your teeth, don't rinse your mouth out. Just spit the toothpaste out and let minerals, whatever minerals are in that toothpaste, allow to help to remineralize your teeth. So that's one thing that's easy to do, I think. Swishing your mouth out with water after you eat is another good one. Something simple.
Hmm. Sabrina,
I
what
think
would you
also,
say? Yeah.
I think also it's like instilling, it does run in your family, but also changing habits that maybe were in your family in the past. So if your parents taught you something, maybe it's time for you to change the narrative and then incorporate things to show now your next generation that things can change, which could have an effect systemically on their next generation, and you could start changing that conversation around the teeth as a negative and be like, okay, but what do we have and then maybe they can look at the things that are around what they're doing as opposed to making it seem as a genetic thing.
This reminds me of a story. A neighbor, it was about my age. When she was 18 years old, her parents gave her the gift of graduation by removing her teeth and giving her dentures.
Oh my
Yes,
gosh.
because their belief system was that you're going to lose your teeth anyway. We're just going to go ahead and take care of it so you don't have to go through the trauma, the pain, and all the dealing with it. So we're just going to go ahead and give you your dentures at 18.
That's why we're
So
thankful that you guys do this podcast.
And
Oh
I'm
my.
thinking, yeah, I want to die with my teeth. And I jokingly tell my kids, if I don't have teeth, then you get nothing.
Yeah.
Well,
So don't put me in a nursing home and just let me rot.
I do find though, don't you find, ladies, like I mean here and the people I don't know. I find that nowadays, like our generation, like the 40s, the 50, like are more into their children's health and their
Hmm.
teeth than they used to be. They want the best for their kids. They want them brushing teeth. They want them, they get them the things that they need and that you suggest for the most part if they're able. Sometimes again it becomes a financial thing, but for the most part, maybe they had, bad experiences at the dentist, but now they're wanting the better thing for their kids, and they're on them a lot more. I don't enjoy when, kids come in and they are fearful, like you said, about a cavity. We were talking about cavities
Hmm.
and they are afraid. It's just, and they look at their parent with this like fear, like they're just going to start breaking down to cry because probably the parent said, if you have a cavity, I'm going to tell you,
Hmm.
you should have been eating all that candy, blah, blah, blah. And then that's when we go, but like it's okay. You shouldn't eat the candy,
Right.
they're right. But because I don't want that child to be coming into the dentist the next time in a fear panic, that like every time I come in, so we have to
Right.
change again the narrative, right? So
Right.
I just think, but I do think they're on it either too extreme, but most of them will listen and value what you have to say and they'll instill good qualities and kids come in a little more with less plaque and less, you know, fear of the dentist than they used to, right? I don't know.
Yeah.
That's just my observation in the last little bit. Maybe it's the office now that I'm working in, but I
Hmm.
feel like yeah.
It's interesting, Sabrina, because you just said that, parents get on their kids about eating candy. Well, who is buying the candy?
That's what I was
Are
thinking,
are your
Dabney.
are your kids
Right.
going to the
That's my
grocery store?
point.
Are your kids going to the grocery store and buying
Exactly.
a bunch of junk and coming home and piling it on in their mouth?
Right.
No, mom and dad are buying the junk and bringing it in the house. If it's not in the house, the kids aren't going to have it. And that irks me as much as anything as a hygienist to have parents
Mhm.
blame their kids. It's like it's not completely their fault. And
No.
I mean, I was a sugar fiend. Like for personally, I consumed quite a bit of sugary stuff. I mean, it was homemade stuff. My mom was a baker and a cook. My
Mm.
brother, he liked more of the salty stuff, but I never had a cavity as a kid, and he had several. So it's not always the sugar.
Yeah, exactly.
It has to be the right bacteria along with the sugar.
Right, exactly right. And the acid that could be, coming up as well. So there's so many different factors in cavities, but yes, um, yeah, absolutely, yes.
Yeah.
I know
And
we
that
kind of
and
went off
that
a little bit, but no, it's
yeah.
it
Well,
was yeah. I just find that they are a little bit more like I'm just thinking of yesterday, in fact, like I had a young guy come in with, I don't know, I think he was 14 or 15, full mouth of braces. Like I'm like young, teenage. I was like,
mhm.
oh no, this is gonna be fun. I'm gonna have to get I had the thick piezo ready. I was like, maybe I'm gonna have to use that because it's gonna be a plaque and stuff all over. Came in, cleanest teeth I've ever seen. I was like,
Wow.
wow.
Oh,
I was like, huh, interesting.
impressive.
Impressive. I'm like, what do you do? He's like, oh, I use the water pick at least twice a
Mhm.
day, and I have this two special electric toothbrush head that's for ortho, and I'm really mindful about it. And I'm like, wow. I'm
You should
like,
be the poster child.
I know, I totally wanted him to be it, and a beautiful smile, good looking kid. I was like, wow, surprised me. I like literally was so surprised. I
Especially with
was
a dude, right?
right.
Yes.
But maybe
Not
he's into
not
the
to be,
girls. Maybe that's their girl. That's
stereotypical.
the time where they start to get into like girls and stuff. So maybe that's why he's
Mhm.
trying to keep that nice smile fresh and not have stuff in his teeth. I don't know, but it was like
Mhm.
impressive.
That is
Well,
good.
and that brings us to the next one is sugar is the only cause of cavities.
Yeah.
Yep, true that. Yeah, the acid and the acid attacks that we have during the day is not just about the sugar necessarily, but it can be acid. Diet Cola has no sugar, but you still have the acid in it.
Yes.
Coffee, black coffee is acidic. A lot of times patients, and I enjoyed your little reel you did the other day on the sugar, but
Oh,
patients will drink coffee all day long and never consider that their teeth are being demineralized. That constant acidic environment, that breakdown, so there's lots of different factors that can cause. And like I told you, I gave my children sugary treats that were as bad as battery acid.
Yeah.
So the acid that the bacteria make from the sugars or just plain old acid from what we eat and drink, lemon, lemon juice is good for you, but it can harm your teeth and it has no sugar in it. So those are this lots of different avenues that we don't always think about. But again, when you have a few minutes to talk with your patient, it's a nice opportunity to learn what they're doing so that you can figure it out. Because there's some root cause, and that's important too. You brought that up earlier, Dabney, about root cause. There's more about root cause now in dentistry than there used to be.
Thank
I don't want
goodness.
to, yeah, thank goodness. I don't want to make a night guard for you because there's obviously something else going on. And I tell patients, this is just to get you through. Let's figure out let's educate you and figure out what's going on so you'll understand, so you can get better, not just put a band-aid on it. So I'm all
Right.
about the root cause too.
Right.
So I have a question for both of you, just as a curiosity. I want to know what you suggest your patients, for those who are health-minded and do the like apple cider vinegar in the morning or the lemon and water in the morning. What is your go-to for these? If considering it's demineralizing, what do you suggest, or how do you suggest? Did you just say take it every day? Still, it's okay. Do you say rinse with warm water after? Do you say drink it with a straw? Like, or do you just
Mhm.
not have a,
So what is the purpose in that they're doing it for? They're doing it for health reasons, and they just
yeah,
decided
because
and they're
every
just on
morning
this
you,
wagon. They're
yeah,
on
no, they do it for their own, like they do like, it's, warm water with lemon
right.
and
A
honey,
liver
and then
detox
the
or
liver
whatever.
detox, or they're
Mhm.
doing like with turmeric and apple cider vinegar. It's like
Mhm.
good for your gut to start your microbiome going and the like, digestive, I suppose. So I'm curious because I sometimes get these questions and I think, okay, like, I mean, I do it, but I don't do it daily, or I just quickly down it and then I'm done. I don't sip on
Mhm.
it.
Yeah.
Yeah.
Maybe that's helping me.
I think that's
Um,
probably the key, Sabrina, is just
I
to
think,
just drink it and not to
yeah,
sip. Like it's sipping anything, even if
right,
it's
of
a
course.
Diet Coke, right? So
Mhm.
yeah, I think that would be a
And then they were
discouragement
like,
for
should I
them.
drink it through a straw? And I was like, well, that could
No, doesn't
probably,
matter.
I don't know. And then, because they're still going to have it in your mouth, swishing
Right.
around probably. And then, so I just was like, that's all I would say. Just drink it all in one sitting, then maybe rinse with some nice, just clean water
Or
and
maybe just eat, eat and
eat
have some
something.
food. Have some food that gets some saliva in there, to help bring that pH back
Remineralize.
up.
Yeah.
Yeah, help bring that pH back up.
Yeah.
Yeah.
It's just a,
Yeah, I usually tell patients to try to keep it limited. So if you're going to have your candy, don't do it all day or don't drink it all day. You drink it, swish your mouth out with water, even as xylitol mint, if they can pop them in and to bring the pH level up, or even do a quick
right.
baking
Okay.
soda and water rinse. A lot of times I'll tell patients to make their own rinse with the baking soda because that's alkaline and can bring the pH levels up. So lots of different ways. It's just what works in their lifestyle, I think. But
I
Hmm.
that's a
just thought
good
maybe,
question.
yeah, I just thought it could be something that people would ask. Well, if I can't, like, I drink the coffee, then what should I do? Right. Like that's, and we all know it's like time over time. So I think the answer is just do it, finish it, rinse, do something to remineralize, and away you go.
Right.
Yeah.
Yeah,
I've
and
often,
and one of the things, with sugar only, like sugar is not the only thing that causes cavities. You touched about dry mouth. That's a big deal in
Yeah.
looking at, how somebody breathes. Those are all important avenues to discover with our patients who
Mhm.
are, maybe a higher risk for cavities.
Absolutely. Dry mouth to me is one of the most under discussed conversations we have in the dental chair because oftentimes, unless you're really, really honed in on it, and these days I really am because I've missed it in the past when I was not educated about it and I feel like I could have helped patients. But it sometimes they don't show it clinically that they are dry. But when you start looking at the airway signs, so my myofunctional therapy showed me ways to understand that more than I did before, with the way that their palate is. Their airway, their palate, their tongue posture, if their tongue is fissured, if they've got the tori or they've gotten the flattened teeth, we know they're clenching or grinding, which a lot of times is linked to the airway. And so when I start seeing these signs, I mean, and even the way their face is shaped, if it's a long face versus a round face, we know
Mhm.
that the palate is more narrow. So in my mind, I'm already building a case of what I think I'm going to see. And oftentimes I do see it. This is the hard part though, is if a patient has never had that thought, nobody's ever told them that, and here a new hygienist or a hygienist is telling them something they've never heard before, and they're scary, it's fearful a little bit because this is your health you're including in that. It can be really a hard conversation. So trying to address different patients in different ways too has been a challenge for me. Learning through O'Hare helped me tremendously to do that. But if you're too aggressive with some patients and they're fearful, then you'll invoke that. But you want to educate at the same time because their health is your most important thought at that moment. But yes, the dry mouth and them not being aware of it to me is really, really an important conversation to have.
Yeah, that's a good point. Because, some people, it happens so gradually, it just becomes their new normal, and they don't
Hmm.
even realize their mouth is dry because it happened so gradually and it just became who they were.
Hmm.
So they don't even think about it twice.
Absolutely. Ashwagandha is one thing. It's that natural herb that you take. I take a holistic hormone balancing drop, and the ashwagandha was causing my mouth to be dry, but I didn't realize it until
Yeah,
somebody said it can cause dryness. I'm like, huh, well, maybe that's why my mouth is a little bit dry in the morning. I didn't realize that was what it was.
yeah,
And even, a lot of patients take antihistamines. That never crosses our mind that that's going to dry your sinuses up, but it's also going to dry your mouth up.
right.
Omeprazole, like you said, is another one that I noticed personally when I was on that medicine. But once I cleaned up my diet, of course, I didn't need it anymore. So,
Bingo.
yeah,
Good for
yeah,
you.
yep,
Yeah.
absolutely.
Myth number 7, fluoride is the only way to prevent cavities. That's
Like
a
this
hot
one with
topic.
it is a hot topic. So we know that the science behind nanohydroxyapatite is really coming along. And some doctors, some dentists will say, well, we don't have enough studies. There's a lots of studies. There's over 3,400 studies about hydroxyapatite and the benefits of remineralization. And all hydroxyapatite, I don't know why they just can't make a simpler word for it, but it's calcium and phosphate.
Right. It's
That's
what's in our saliva, right?
it's in your saliva. Your body makes it. If you don't need it, then your stomach acids eat it up. There's fear mongering about it breaks the blood-brain barrier, but science is showing that it doesn't do that. Your body is biocompatible. So fluoride is not the only way, and that's a good point because a lot of, like you were talking about earlier, these mothers are coming in. They're savvy. They've done their studies. They know what they're talking about. They talk with their friends. They have conversations, I think, at the coffee house about these things. And it's important for them to understand that there needs to be some kind of mineral that's helping their teeth to remineralize if they choose not to use fluoride. So I think that's really important. But I'm a big nanohydroxyapatite, 10% crystals to remineralize with. And then I'll tell patients too, it's in your saliva. So just lick your teeth every day. If your mouth is a little bit dry, lick your teeth. That'll increase your saliva flow. And that's going to give you those minerals back too.
That's a cool tip. I hadn't heard that one before.
I tell patients after if they choose to do the fluoride varnish, to lick their teeth like they never licked to get that saliva flow, to get that varnish to stick. And then they get the uptake of the fluoride better if they can get that process going.
Yeah, there was a question that I had this week about fluoride and in the water versus how it is in the dental office. And, people think all fluoride is the same. And,
Mhm.
we haven't done a great job in helping people understand that water fluoridation is to help children who are growing teeth.
Growing.
And once the teeth have entered into the mouth, fluoride in the water isn't really as beneficial for us anymore. But the fluoride in the dental office is topical, and so it is beneficial. And I don't recommend it for every person because I don't think every person can benefit from it. But there are
Mhm.
some people who do, and I recommend it to people who I think can benefit from this mineral.
Do you
Absolutely.
recommend a fluoride rinse to the elderly population at night?
I have not. Do you?
Mhm.
Our dentist does. She's a high proponent of it now. Feels that it helps with, because these patients have dry mouth. She feels that a lot of them get like root caries because they have a lot of root exposure. So
Mhm.
Mhm.
she has seen a benefit to suggesting, and I mean, not like it's not, she does a smart rinse for kids because it's more tolerable for the patients than it is like the regular adult fluoride rinse. And a lot of them add it just into their daily routine after they brush their teeth at night. They'll do the fluoride rinse. Not every, just the ones that have a lot of root exposure,
Hmm.
or have high carry rate or dry mouth, these things. I don't know. So that's what she likes to suggest. Yeah.
I'm a big fan of xylitol. That was what I wrote my research paper on for O'Hare when I graduated. And xylitol can be such a great addition to our saliva to have that help increase the saliva and keep the alkalinity up and keep the bacteria at minimal. So I think xylitol, and I don't see using a separate rinse if they're brushing their teeth with the fluoridated toothpaste and they're not rinsing. So I don't see a separate rinse for that. But we do know, like you said, those root caries demineralization starts about 6.4% or 6.5. So our roots are not very strong when able to withstand acid exposure over a long period of time.
Hmm.
And I don't know if it maybe is just for the mobility and the brushing of within that age group, like it decreases, I don't know if they're hitting, like they don't have
Hmm.
that pressure to like get in there and kind of do the great brushing. So
Hmm.
maybe the toothpaste isn't staying on their teeth enough. I don't know, but it's
Hmm.
kind of something that she's started to suggest. I also suggest xylitol in
Hmm.
cases because sometimes people are like, I don't know if I really want to do fluoride. They're not big on it.
Hmm.
So options, right?
Absolutely. I love to be able to give patients options and figure out what's best for them because what one
Hmm.
works for one may not work for the other. But we know fluoride works. If you have the saliva to help you, that's the only problem
Yeah,
is
exactly.
you've got to have that saliva or you won't have full appetite. So,
Yeah.
Yeah.
Xylitol is a great product. I recommend it a lot as well. Yeah.
yes.
Fluoride could be like a topic on its own. There's so many things in it.
Yes,
Yes.
true.
Very controversial these days.
Controversial.
Yeah, I
And
can't
then
wait.
like, how
Yeah.
you're getting it, where you get it. Is it in the water? Shouldn't it be in the water? It's like well water. What versus this? And then some people think, oh,
Hmm.
is it really worth it to do like fluoride one treatment and off? Like there's all these conversations around it that happen. So
Hmm.
I love myth number 8. Mouthwash keeps your mouth healthy. Man,
All
oh
right, so we've
man.
all used scope, right? We know scope just
Listerine.
yeah, it just freshens your breath and maybe for a few minutes. So I diagnosed or co-diagnosed a patient with periodontal disease a few weeks ago, and he was using a mouthwash with alcohol in it twice a day.
oh,
Hmm.
And I said, would you consider not using it so much? I said, I feel like that the alcohol is killing the good and the bad bacteria. And I said, your mouth is just as important to keep the balance as your stomach and your gut, or your guts are. And he seemed to understand. But we go with that old myth too, like if it's burning, it's working. Like
Oh yeah, yeah.
I live near the ocean. If you had a cut, you had to go get in the ocean to have it burn, a little bit and sting so you could heal. So I think, and the mouthwash is easier. Let's be honest. It's easier to rinse my mouth out than it is to floss or to water floss or to brush. So oftentimes I think it's just been one of those things where our parents did it. They did okay, so we're going to do it. And it's easy. And we just don't
Well,
know. We
and
don't
as a
know.
profession, I think we've touted it too. Like, we said you need to brush your teeth, you need to floss your teeth, which we all know flossing is ugh. And then use your mouth rinse. So it's
Hmm.
just been this, plan that we've been talking about for decades. But we now know, we have information now that our mouth is not supposed to be sterile. We're
Exactly.
supposed to have bacteria in there that helps us with breaking down our food. It's the part of our digestive system.
Hmm.
And with doing salivary testing, we know that there's certain bugs, the red complex, that they're super bugs. So they love the mouth rinse because they have figured out a way to get around, dying off. And now they feed on the alcohol in the mouth rinse, and they actually grow.
Get
So it
stronger.
actually can make your periodontal disease worse by using
Hmm.
mouth rinses.
Know
That's
that.
amazing.
Yes. I feel like that we didn't go through, we were told to use these products, but we never in dental hygiene school or in my career have sat down and looked at the ingredients in most of our products that we use. And once we look at our food labels, why don't we look at our toothpaste, our mouthwash, and make sure that that's what we want to put in our bodies as well? and understand that we do swallow a certain amount of our mouthwash, our toothpaste. If you use floss with wax on it, you may get some plastics from the floss. So it's just knowing and understanding these things and applying it to our mouth, not just our body. It's
Right.
really important.
Because that mouth rinse is going to get down in your digestive system. It's going to wreck your digestive system. It's
Hmm.
going to kill your microbiome. That is really beneficial for assimilating your food and getting the nutrients that you need.
Exactly. Yeah. And I'll mention to patients too, if you're not eating a healthy diet, like Sabrina said earlier, we're going to see it in the mouth because your saliva can't be fertile and nutrient filled if you're eating junk in, junk out. And so I try to link that. And that's one thing we talk about in the book. I link nutrition to the mouth. We talk about this in the hygiene school, but we don't often have time in the dental chair. And honestly, I wrote beyond the dental chair what your hygienist didn't tell you about your mouth, but I almost wrote what your hygienist didn't have time to tell you
Yes, I
about your
think
mouth.
so.
But I didn't do that. But I think it's important that patients just don't understand, these myths. And I think this is a great conversation to have to help patients understand and to help each other learn and grow in the hygiene field, the dental field too. The what we learned 10 years ago doesn't apply anymore most of the time. It's changing, it's evolving, and staying on top of that's really important,
Yeah.
educating ourselves.
Yeah. Myth number 9, losing teeth is just a part of getting older. And I think, it takes me right back to that, my neighbor whose family took her teeth out at 18.
Yep.
Like that was their belief system.
Yeah, you don't have to lose your teeth, and I try to tell, especially my children, we want to keep your teeth until you're 100. You're 10 years old now, so we need them for 90 more years. We kind of make a joke about it, but I'm truly saying your teeth should
Hmm.
last forever. I had a patient today in my chair that said she had some gum recession. She clenched and ground her teeth. She had some bone in the floor, and she said, "Well, does my recession look equal to my age?" And I said, well, if we don't have, I call it extracurricular activities, if we don't do these extra things and cause this damage to ourselves, we're not going to have that. I said, but comparatively to other people, your gums and bone relationships look good as far as the recession, but it doesn't have to happen. If we can identify a lot of the things that we're talking about today. So I
Hmm.
think, I think we do think that our teeth are going to be lost as we get older, especially if our parents or grandparents. I mean, my granddad would take his teeth out and kind of like he's going to bite you with them. I think everybody's granddaddy done that to everybody. So you just think, okay, I'm gonna lose my teeth, and it doesn't give you much motivation or encouragement to try to take care. And then if we don't get to see patients and at least have some kind of impact on their life at some point, not everybody goes to the dentist. We don't have a chance to educate them on those facts.
Yeah. Well, there's things like inflammation, infections, medications. People who have diabetes, they certainly have
Yep.
a greater chance of losing teeth and having
Mhm.
infections because of their slow healing. But
Mhm.
if it's well managed, they have as good a chance as anyone else. But
Yes.
it's managing their disease, right?
Yes.
Yep.
And
Agreed.
like you said, there a lot of I don't, when I ask patients what their doctor's telling them about their mouth, I don't get a lot of feedback from patients who have learned anything, their oral health from their providers or healthcare providers.
Yeah.
As I ask that question, I want to know what their perception of what the doctors are telling them to help them to be healthy.
Yeah. Myth number 10, oral health only affects your mouth.
Well, we know that's not true because the bacteria can enter that bloodstream, that slow trickle of infection that you don't feel sometimes, like you mentioned earlier, Dabney, about like in having an abscess. It doesn't hurt until that swelling gets big enough to put pressure on that bone, and then and it hurts bad, and it happens fast. So we know that the bacteria in the mouth, it creates inflammation, and it's bidirectional, so it goes both ways. So again, diabetes sends inflammation top to bottom. So it does affect your whole body. The scary thing is we don't feel it day in and day out until it gets really bad. Like you said, if you get septic or you have a infection close to the brain, and then that can cause you more immediate acute, they can say, but
Hmm.
it does affect us day in and day out, but it happens so slowly we don't even realize it.
Yeah, that's a good point. And no, and with salivary testing, we can see if there's red complexes that certainly have a component with diabetes, autoimmune diseases, cardiovascular disease. Then we have the orange complexes, which is more associated with like digestive issues that can lead to certain types of cancer. And so understanding our microbiome helps us understand our risk factors in the systemic environment because we're swallowing a liter of saliva at least a day. And if we think that all those microbes are sitting around next to our teeth and gums, it's not. It's all through our body system. Yeah.
Absolutely. And oftentimes when I ask patients about do they know about the system or systemic link, if they know, they've read about it. Nobody else has told them they've actually read literature about it, which that upsets me. That's disappointing to me for all of our medical providers that we're not talking about it more.
Hmm. Yeah, there's just there's still a disconnection. I'm sorry, Sabrina, what do you want to say?
No, go ahead. I was going to say the same thing. Yeah,
Mm-hmm.
go ahead.
Yeah. And
Yeah.
I just think there needs to be more information out there, but when there's meetings, you have to go to the certain meeting to hear it. You have to read the certain article to understand it. And so not everybody is into this world. I mean, all three of us were trained to be preventative agents. So when we go and talk to our patients, our goal is to help prevent them from needing care down in at the dental, restorative area. And how can we help them have a better function in life? So our mindset is open to understand and try to help people be healthy. Dentists, by and large, they're looking for holes to fill because that's how they're trained. Much like doctors are trained to give medications to help with symptoms, never really getting to root causes. So I think that's what puts dental hygienists different in our field is that we are trying to prevent. We're not necessarily looking for, you know, other things. We're looking for the root cause.
Yes,
Great.
Hmm.
I agree.
So, Becky, thanks for joining us today and helping us understand and break through some of these myths. If people understand just one thing about the oral systemic connection, which one do you think would motivate them the most?
Hmm. Um, just because you don't see bleeding doesn't mean there's not inflammation in your mouth. And
Hmm.
if you have a systemic disease, then pay close attention to your oral health. Look in the mirror, ask for a mirror when you're in the dental chair. Be on the lookout. Just be mindful, be more intentional that there could be disease processes that are starting that you may be unaware of.
Good information. Good answer.
Great
Sabrina, do you have
information.
anything else?
Nope, I think we covered a lot today. And I think like a lot of these topics we could expand on so much, and it could be another hour while we're here, like on us. We could be a definite part two conversation because I know that listeners would want to know different ways, to prevent things and, what should I do if I have this? And we didn't really do a lot of that today. It was more just breaking myths. So dispelling myths, I suppose. So I think that we should do a round two.
Yeah, round two it is.
I'm in.
All right. Well, thanks for joining us today on the Lifestyle Herbalist.